Good afternoon, everyone. So today we will discuss about mycotoxins and mycotoxicoses. So we will define what are mycotoxins. Mycotoxins are compounds produced in grain by specific molds or fungi as their secondary metabolites. So when we say secondary metabolites, they are compound usually produced during the stationary phase of the growth cycle of the organism, and they are not necessary for their growth or for the maintenance of other specific functions. So they are substances produced by molds that contaminate various agricultural commodities, either before harvest or pre-harvest or under post-harvest conditions. And when you say mycotoxicoses, these are the intoxications caused by ingestion of foodstuffs contaminated with mycotoxins. So usually the condition mycotoxicoses are non-contagious, sporadic, seasonal, and associated only with certain batches of feeds. The effects of these mycotoxicoses, which are caused by the ingestion of these mycotoxins in animals, are diverse. They vary from immune suppression to death in severe cases. It depends on the toxin also that was ingested, and the animal and environmental factors are also considered. Mycotoxicoses, they are often present as an uncertain subacute or chronic condition. For the history in veterinary medicine, early 1960s, the discovery of aflatoxins as the causative agent in the peanut meal causing the turkey X disease that was reported to kill more than 10,000 turkeys poultry farm in England were fed with contaminated milk. While in humans, it was described during World War II when Russian soldiers suffered severe dermal necrosis, hemorrhage, and destruction of bone marrow after they ingested or ate moldy grains, which was known to be contaminated with this fungi Fusarium, genus Fusarium. In the last 40 years, many new mycotoxins have been identified and characterized. 25% of the world's agricultural product is contaminated with mycotoxins, and certain diseases have been linked to ingestion of food and feed contaminated with mycotoxins. So we call this fungi as toxigenic fungi, which are known to be the fungal organisms that known to produce mycotoxins. Usually they can grow in corn, cereal, soybean, sorghum, peanuts, silage, and other food and feed crops or hay in the field. They are usually under the genera, or they belong to the genera Penicillium, Aspergillus, Fusarium, and Claviceps, and others. But these are the most important genera of the toxigenic fungi. Contamination of feedstuffs with mycotoxins poses a serious threat to the health and also in the productivity of different animals. So what are the characteristics of mycotoxins? They are usually of low molecular weight. They are known to be very heat-stable substances, non-antigenic, since they do not induce a protective immune response. They are invisible also. Many are active at low dietary levels. They are tasteless, so the palatability of the food will not be affected. They are stable chemically. They are known to be resistant to temperature and storage, and they cannot be destroyed during animal feed manufacturing process. They induce the disease, of course, through ingestion of the contaminated plants. They are non-contagious, non-sporadic, seasonal, and associated with batches of feed, as mentioned earlier. Clinical appearance and level of mycotoxin in the feed and animal tissue usually indicate the existence of mycotoxin. Toxic effects include immunosuppression, mutagenesis. So they are also known to be teratogenic and carcinogenic. So they can induce carcinogenesis, or they are cancer-causing substances. Accumulation in tissues of food-producing animals or excretion in milk may result in human exposure. So we'll go now to the epidemiological and clinical features of mycotoxicoses. Outbreaks are usually seasonal and sporadic. There is no evidence of lateral spread to in-contact animals. So very specific to the animals that have only that kind of feed or that batch of feed that you gave as their feeds, but not with the other animals in the farm that were not fed with that batch of feed. They will not be affected. So there is no lateral spread to other animals. Certain types of pasture or stored feed may be involved. Clinical presentation is usually ill-defined. The severity of clinical signs is influenced by the amount of the mycotoxin ingested. Recovery is related to duration of exposure. Antimicrobial medication is ineffective, so you cannot administer antibacterial drugs or antibiotic because this is not effective for mycotoxicoses. Confirmation usually requires demonstration of significant levels of mycotoxin in feed or in tissues from affected animals. So we have this summary of all the mycotoxins produced by the specific fungal organism, the disease that they cause, the species affected, and the geographical distribution, and what are the clinical findings, functional or structural effects. So this is summarized in table 47.1, mycotoxicoses of domestic animals. So please try to read this and memorize. And an example that we have here are aflatoxicoses, which is the disease, and it is known to produce aflatoxins. And these are the most potent aflatoxins, B1, B2, G1, and G2. What are the fungi, the toxigenic fungi known to produce this aflatoxin? We have Aspergillus flavus and Aspergillus parasiticus in maize, stored grain, groundnuts, and soybeans. And the species affected are usually pigs, poultry, cattle, dogs, worldwide, yung distribution niya. Functional or structural effects they are known to be very toxic in the liver. So hepatotoxicity, immunosuppression, mutagenesis, they induce mutagenesis, so they induce mutation, and teratogenic, carcinogenic. Clinical findings, the animal is ill-thrift. If the animal is producing milk, there will be drop in milk production or yield, and rarely death from acute toxicity. Please see the scanned copies of the mycotoxicoses for the complete details of these different mycotoxins, diseases, the fungi, organism, and other clinical findings associated with this specific mycotoxins. So there are more than 100 fungal species known to elaborate toxins. Approximately, there are 400 secondary metabolites with toxigenic activity produced by this fungi. Many of these belong to the genera Penicillium, Aspergillus, Fusarium, and Claviceps. So we have different types of these mycotoxins. So there are mycotoxins classified to be hepatotoxic, neurotoxic, those that are known to cause degeneration of the kidneys and other lesions involving the kidneys. And there are toxins that have estrogenic effect. So we have the hepatotoxic mycotoxin rather, which is known to be the aflatoxins, sporidesmine, fomopsins A, B, C, D, E, and stigmatocysteine. Neurotoxic mycotoxin are ergometrine, ergocristine, lolitram B, paspalinine, paspalitrams A, B, and C, and deoxynivalenol. Renal lesions are produced by citrinine mycotoxin, ochratoxin or ochratoxins, A, B, C, and D. Estrogenic activity is known to be caused by this mycotoxin zearalenone produced by Fusarium graminearum. So these are the different effects of mycotoxins on the health of animals, usually livestock animals, even other animals like horses. So this is an image showing the effects of mycotoxins on the health of poultry. So we can see here that there are various effects depending what are the mycotoxins. Like, for example, we have the OTA here. OTA is ochratoxin A. It causes damage of the kidneys. We mentioned this is a mycotoxin that is known to cause renal lesions, degenerative lesions of the kidney, and also increase water consumption. We have here in the egg, which when they are present here, they will be cause of exposure to humans since humans consume eggs. These are AFB, aflatoxin B1, ochratoxin A. We have the T2 toxin. We have the DON or the deoxynivalenol, and the ZON, which is the zearalenone. They are known to produce lower eggshell quality, blood and meat spots, and cream yolk. So these are other effects of the different mycotoxins also in poultry. There are those that cause decreased hatchability, decrease in the egg production, causing embryonic losses, ovarian cysts, delayed sexual maturation, which is caused by zearalenone, deoxynivalenol, T2 toxin, diacetoxyskirpenol, DAS, and ergots, ergot alkaloids. These are the different effects of mycotoxins on the health of dogs. We can see that all mycotoxins can cause poor growth, immunosuppression, and increased mortality in dogs. And then there are specific aflatoxins that are causing vomiting, depression, polydipsia, polyuria, hepatitis, anorexia, and death in dogs. Zearalenone, it is also known to cause pathologic changes in the reproductive system. Ochratoxin A, the OTA, known to cause kidney damage. Trichotesins, feed refusal, and vomiting. Roquefortin is light salivation, vomiting, ataxia, and tremors. These are the effects of mycotoxins on the health of cats. Same with in dogs. All mycotoxins are known to cause fur growth, immunosuppression, and there are also similarities in terms of the aflatoxin effect, trichotesins, and the ochratoxin A on the health of cats. This one is the effects of mycotoxins on dairy cows. So for dairy cows, there are various effects like milk contamination, decreased milk production, laminitis, decrease in the feed intake, and others. Even diarrhea, impaired rumen function, gastroenteritis are known to be effects of mycotoxins in dairy cattle. So these are the specific mycotoxins producing these different effects. And we have also the effects in aquatic animals, in the health of fish. So these are the trichotesins, dioxynivalenol, and T2 toxin that cause reduced feed consumption, lower hematocrit values, lower blood hemoglobin value, poorer feed conversion ratio. All mycotoxins are known to reduce growth, higher mortality, and lower weight gain. And others like aflatoxin B1, fumonisin B1, and ochratoxin A. These are the effects of mycotoxins on the health of horses. So there are also various mycotoxins affecting the horse, like fumonisins here, especially with the dosage of 1 kilogram per kilogram of feed. It can cause leukoencephalomalacia, neurological troubles, feed refusal, colic, and death, and others. These are the effect of mycotoxins on pigs or swine. So we have fumonisin that is known to cause pulmonary edema. and others. Trichoticins decrease in the feed consumption and growth. Ochratoxin is very specific that it causes renal lesions and others. Zearalenone, it is more on the reproductive system effect. Poor fertility, reduced sperm quality and quantity among boars, reduced litter size, abortion, high culling rate, increased unproductive time of the sow. We have aflatoxins effect, increased sensitivity to pathogens, although this is known to be hepatotoxic, but in pigs it increased sensitivity to pathogen, limited growth, abortion, and agalactia. How do we diagnose? Based on the presence of characteristic clinical presentation, demonstration of the significant levels of specific mycotoxin in feed or in animal tissues. So we'll start now with the specific mycotoxicoses, the fungi that produce the mycotoxin, their clinical effects, diagnosis, and others, prevention, treatment, how do we control? So first, we will discuss aflatoxicosis. This is a disease associated with ingestion of aflatoxins produced by Aspergillus flavus parasiticus and some other Aspergillus species. It is known to be produced in maize, soybeans, ground nuts. Aflatoxins B1, B2, G1, and G2 are important in disease production. B1 is known to be the most toxic to humans and animals, most encountered in disease outbreak. It mainly targets the liver. This is the principal organ affected by aflatoxins, resulting in hepatocellular necrosis and impaired liver function. While aflatoxin M1, it is known to be excreted in milk, especially among dairy cow. So it is a most well-known mycotoxin, yung aflatoxin. Can grow on cereals, groundnuts, soybeans. And we mentioned the other aflatoxins M1 a while ago, which is excreted in the milk, and also the M2. Yung kanyang MOA, it binds to the macromolecule like the nucleic acid, nucleoprotein. It reduces protein synthesis, causing cancer because it is carcinogenic, also teratogenic, and cause aplasia of the thymic cortex, resulting to depressed also of the cell-mediated immunity of the animal. Okay, so what are the toxic effects that we mentioned? Clinical findings, considerable variation in susceptibility between species and within age groups. Ducklings, turkeys, poults, calves, pigs, and dogs are sensitive to the toxic effects of aflatoxins. Uncommon in horses and goats, acute aflatoxicosis has been recorded in birds and cattle. In ducklings, it can cause ataxia, opisthotonus, and sudden death. Hepatopathy and subcutaneous hemorrhages in 3-week-old animal. Calves, it can cause blindness, tenesmus, circling, diarrhea, and convulsions. So the clinical signs are vague, and samples, which is the suspected feed material, should be stored at -20 degrees Celsius until it is analyzed in the laboratory. Thin layer chromatography, the TLC, and HPLC, or the high performance liquid chromatography, ultra performance liquid chromatography combined with mass spectrometry are commonly used. Immunoassay techniques such as ELISA and radioimmunoassay procedures, biological assays such as bile duct proliferation in ducklings, chick embryo bioassays, brine shrimp larvae test, and trout embryo bioassays. How do we control and prevent the aflatoxicosis? Appropriate measures should be followed following harvest and during the storage. It is very important that during the storage, the feed material are kept in a well-ventilated building or room. Batches of food for human and animal consumption may be monitored for the aflatoxin consumption because this is a zoonotic condition, the aflatoxicosis. Treatment with ammonia gas at high temperature and pressure to detoxify contaminated batches of feed. Aflatoxin B1 and G1 are rapidly degraded by 2% ozone, but aflatoxins B1 and G2 are most resistant and require treatment with 20% ozone for rapid degradation. Dilution of contaminated feed with uncontaminated supply to reduce aflatoxin concentration. Okay, so batches of food for human and animal consumption may be monitored for the aflatoxin contamination. And addition of hydrated sodium calcium aminosilicate to feed is beneficial. Glucomannan containing polymers extracted from yeast cell walls have a high adsorptive capacity to bind different mycotoxins, including aflatoxin B1. In commercially available feeds, usually there are also mycotoxin binding component added in the feeds. But of course, we know that some mycotoxins are not being bind, so that's why they are still potent and ingested by the animals. Next, we have the condition ergotism. What is ergotism? This is a disease occurring worldwide in domestic animals, in humans also, following ingestion of the toxic level of certain ergopeptide alkaloids found in the sclerotia of Claviceps purpurea. Claviceps purpurea is known to colonize the seed heads of ryegrasses and cereal such as rye and barley. Toxicity may be retained in silage. So the condition is acquired through ingestion of the ergopeptide alkaloids, which are known to be the ergotamine and ergometrin, the most common ergot alkaloids. Ascospore and hypae in ovarian tissue form a sclerotia or ergot, and this contains ergotamine, ergocrispin, and ergometrin, alkaloid derivative of lysergic acid. Clinical findings are convulsive ergotism, which is uncommon, but this is the acute form of the disease. Following the ingestion of large amount of mycotoxin, these are observed to be occurring in sheep, cattle, horses. Clinical signs are staggering, convulsive episodes, and drowsiness. Thrombosis and ischemia of the extremities were also reported. Swelling and redness of the extremities accompanied by lameness and stiffness are followed by terminal gangrene. Chickens, dry gangrene of the comb, wattle, and feet. In warm climates, there is hyperthermia that may occur in cattle after ingestion of the ergopeptide. Pregnant sows may tend to have poor mammary development and low litter sizes, with premature births, low birth weight, and high neonatal mortality due to starvation. Ergopeptide may exert an oxytocin-like effect, and abortion is not usually a clinical feature of the ergotism. The diagnosis based on the clinical signs, presence of ergots in pasture grasses or in grasses used for silage or in grain, provide supporting evidence. Extraction of alkaloids and detection by chromatography with suspect ground grains. Prevention is by immediate change to ergot-free pasture should take place. Regular grazing or topping to prevent seed head formation. Grain containing ergots should not be fed to animals. Removal of ergots from small batches of grain can be achieved mechanically or by flotation methods. Next, we have citrinin toxicoses. It is produced, the citrinin is the mycotoxin, and it is known to be produced by Penicillium citrinum, viridicatum, and expansum. A number of Aspergillus species, like Aspergillus terreus, also known to produce potent nephrotoxin. Citrinin and ultratoxin or ultratoxin A found together in stored cereal grain can act synergistically. Toxic effects are severe damage to the kidneys, hepatic damage, and even suppression of the immunity. Wheat, oats, maize, barley, and rice contain citrinin, mycotoxin. In Scandinavia, porcine nephrosis syndrome was associated with consumption of barley with citrinin. Clinical signs or clinical findings or features are increased water consumption, increased production of diluted urine containing protein, so there is proteinuria. In cattle, there was hemorrhagic syndrome reported. In poultry, the signs of citrinin toxicosis includes lethargy, decreased feed consumption, increased water consumption, and reduced weight gain. Following feeding trials in dogs, there is emesis or vomiting, intussusception, and renal failure. Next, we have the cyclopyrazonic acid toxicosis, CPA, produced by Penicillium species and a number of other Aspergillus species like Flavus and Penicillium camemberti, which is known to be used in the production of gourmet cheese. CPA, or the cyclopyrazonic acid, act as a specific inhibitor of calcium-dependent ATPase or adenosine triphosphate enzyme, ATPase, and affect ion transport across the cell membrane. Pigs show weakness, anorexia, and loss of body weight. In chickens, decreased feed conversion, interfere with the weight gain, and may cause death or mortality. Next, we have diplodocus, known to be a neurotoxic mycotoxin. So the condition is a neuromycotoxicosis. Diplodium maydis is the toxigenic fungi that is grown, that is able to grow on maize cobs, causing diplodocus in farm animals like cattle, sheep, goats, and horses. Clinical signs include stiffness, incoordination, salivation, lacrimation, tremors, ataxia, paralysis, and paresis. Exposure of the pregnant animals, especially for ewes and cow during the second half of pregnancy, results to stillbirth and neonatal death. For lamb and calves, there are spongiform lesions in the brain, and was recorded in Southern Africa and Argentina. Next condition is facial eczema, which is known to caused by Phytomyces chartarum. And the mycotoxin produced is sporidesmin, which is known to be a hepatotoxin. So it is a severe condition, severely affected. The condition causes severe clinical findings, in sheep, cattle, and farm deer, and seasonally common in New Zealand, Australia, South Africa, South America, and parts of Europe. Since the mycotoxin is hepatotoxin, it causes hepatobiliary lesions. Necrosis of biliary epithelium result in obstruction of intrahepatic ducts. Liver failed to excrete phyloerythrin, which is a potent photodynamic compound formed from chlorophyll by enteric organism, distributed to many tissues, and also in the skin. So that's why it is facial eczema. So this condition will be discussed in detail in the pathology, in systemic pathology, where the severely affected animals are sheep, cattle, and farm deer. Clinical findings in sheep: lesions develop in non-pigmented areas which are not covered by wool. Eyelids, muzzle, and ears are inflamed and swollen. Serous exudation and scab formation may be followed by necrosis and sloughing of the skin. Jaundice is usually present because it affects the liver and the hepatobiliary epithelium. Lesions are limited to areas of non-pigmented skin. Milk production may be severely reduced among milking animals. We diagnose based on the clinical signs, especially the photosensitization with jaundice in ruminants is evident. Environmental temperature above 12 degrees along with heavy rainfall provide suitable conditions for the growth of Phytomyces chartarum. Elevated liver enzymes, serum liver enzymes such as the gamma glutamyl transferase when you perform biochem or blood chem examination. Competitive ELISA techniques are used for diagnosis, and this hepatotoxin is sporidesmin, can be detected in bile, urine, plasma, or whole blood. For the control and prevention, routine monitoring of pasture spore counting, spraying with benzimidazole fungicides, accumulation of pasture litter controlled by pasture management techniques, selection of sheep resistant to the toxic effect of sporidesmin by breeding program. Daily administration of zinc salts, which are zinc oxide or zinc sulfate in drinking water, reduces toxicity of spotty desmin. Next, we have the mycotoxic estrogenism, which is known to be produced by the mycotoxin zearalenone. And zearalenone can be produced by Fusarium genus, Fusarium graminearum. Others are Fusarium culmorum, equiseti, and crocwellense, growing on moldy maize, stubble, oats, barley, wheat, rye, and rice produce estrogenic substances. So what is zearalenone? Zearalenone is a potent non-steroidal estrogen. Its metabolites can are able to bind to estrogen receptors, can be excreted in milk, posing a public health risk. So this is mostly produced by Fusarium graminearum, has an estrogenic activity, estrogen-like substance, mycotoxin. Vaginal and rectal prolapse can be produced or as a result of zearalenone, reduced litter size in mature sows, reduced fertility in cattle, like vaginal discharge, nymphomania, abnormal mammary development in prepubertal heifers. Diagnosis by ELISA in pasture samples and in urine. So the mechanism of action, it can initiate specific RNA synthesis, function as a weak estrogen. Swine or the pigs are the most susceptible, especially the prepubertal gilts, causing vulvovaginitis, vulval edema, hyperemia, hypertrophy of mammary glands and uterus. Occasionally can cause vaginal and rectal prolapses. Low for all effect except for the reproductive function. So it is really more on the reproductive system effects. These are the effects of mycotoxins in pigs. This is the vulvovaginitis. Then there are discharges also. Some may cause diarrhea, but the most evident are the reproductive clinical findings. Next, we have the fescue toxicosis. Tall fescue grass, Festuca arodinacea, is a perennial grass adapted to a wide range of soil types and climatic conditions. So for the summer fescue toxicosis caused by ergovalin mycotoxin, which is produced by the toxigenic fungi Neophytogium sinophyalum, affects cattle and sheep in USA, New Zealand, and Australia. Resemble ergotism in herbivores, which is the facial eczema that we have discussed, and developing gangrene and in the extremities of the animal. So there is also that dry gangrene that develops on the distal extremities of hind limbs, tail, and ears of the animals. Induced low serum prolactin leads to a drop in milk production. There is agalactia, prolonged gestation, weak neonates, and thickened placentae. Fescue lameness is associated with low autumn or early winter season. Clinical signs resemble ergotism in herbivores. Severe lameness is followed by gangrene and sloughing of the extremities, especially the digits of the animal. Lesion development is attributed to the vasoconstrictive action of the ergovalin produced. Vasoconstrictive activity of ergovalin is exacerbated by low ambient temperature. Next, we have fumonisin toxicosis. It is produced by a number of Fusarium species, Fusarium verticilloides and proliferatum. So by interfering with sphingolipid synthesis and metabolism, and animals that are most susceptible to the toxic effects of fumonisin are horses and pigs compared to the cattle, sheep, and poultry. So fumonisin is the potent mycotoxin, and B1, the fumonisin B1, has been associated or linked to esophageal cancer in people living in regions of South Africa, China, Italy, and USA. So fumonisin toxicosis causes leukoencephalomalacia in horses, pulmonary edema in pigs, and even hydrothorax, and hepatotoxic and carcinogenic effects in rats. So we can see here that different animals have different manifestations of the clinical effect produced by this fumonisin, mycotoxin. Next, we have the mycotoxic leukoencephalomalacia, which is of course produced by the fumonisins. And fumonisin is produced by various cereal grains and other feed material like the ingestion of moldy maize cobs. Fumonisin B1 is the most frequent cause of toxicity in animals, but there are also other fumonisin. Fusarium verticilloides are responsible for sporadic neurological disease in horses, donkeys, and mules. Sporadic neurological disease, mainly in horses, donkeys, and mules, are resulting to inability to swallow, weakness, staggering, recircling, and marked depression, and mania because there is hepatic failure. In pigs, we mentioned that there is pulmonary edema and hydrothorax. Fumonisin B1 and B2 are associated with the fatal pulmonary edema in pigs. Pulmonary hypertension resulting in pulmonary edema and hydrothorax. Chronic exposure to fumonisin is associated with hepatotoxicosis. Next, we have the moldy sweet potato toxicity, causing acute interstitial pneumonia in cattle, has been associated to eating mold-damaged sweet potatoes, scientific name Ipomoea batatas, in the USA, New Zealand, and Australia. It is a derivative of 4-ipomianol produced by the Fusarium solani, Fusarium oxysporum, and Semitectum. Clinical sign, which is the principal clinical sign, is dyspnea or difficulty in breathing that may occur within 10 hours after the onset of signs or clinical signs. Mycotoxic lupinosis, the lupin seeds contain toxic alkaloids which can produce neurological disturbance in herbivores. Plant toxicosis is distinct from the mycotoxicosis associated with the ingestion of peptide mycotoxin, pomopsins. So the mycotoxin produced is pomopsin, produced by the Diaporte toxica. 5 mycotoxins, A, B, C, D, up to E, produced by Diaporte toxica, can cause neurological disturbance in herbivores. Pathological changes attributable to consumption of pomopsin include hepatosis, muscle injury, and kidney damage. Disease is important in Australia, New Zealand, South Africa, and parts of Europe. So the acute lupinosis may result to hepatic encephalopathy with stupor, stumbling, and recumbency preceding death. Jaundice and photosensitization in surviving animals can be seen. Oral administration of zinc to reduce severity of liver damage is known to be the treatment for this mycotoxic lupinosis. Next, we have the ochratoxicosis or ultratoxicosis. Ochratoxins produced by Penicillium, Verrucosum, and Aspergillus alutaceus. In tropical climates, is very common, found in cereal grains, barley, oats, rye, wheat, maize. They have been detected in these animal byproducts. The most common heat-stable potent nephron. This is nephrotoxic, nephrotoxin, and known to be immunosuppressive and carcinogenic are ochratoxins A, B, C, and D. Species affected are pigs, poultry, and dogs. Ruminants usually have high tolerance for ochratoxin, mycotoxin. So in pigs, there is evidence of inappetence, depression, weight loss, polydipsia, and polyuria, which are features of nephropathy or disease of the kidney. Dogs, there is also renal disease, hepatic damage, and immunosuppression, depressed growth rate, reduced egg production, and poor quality eggs. So the mechanism of action of ochratoxin is disruption of the protein synthesis. It is known to bind strongly to albumin, interfere with the synthesis of transfer and messenger RNAs, disruption of the carbohydrate metabolism, and increased generation of free radicals. So these are produced by Penicillium veridicatum and also Aspergillus ochraceus, which is the ochratoxin A, which is the most potent, produced primarily in cereal grains like barley, oats, corn, and wheat. Next, we have the slaframine toxicoses produced by Rhizoctonia leguminicola, a phytopathogen causing black patch disease of red clover, alfalfa, and other leguminous pasture plants. So the slaframine is the mycotoxin. High temperature is accompanied by high humidity favor fungal growth. So high relative humidity is associated with the mycotoxin production among feed stored raw materials. Horses are sensitive to slaframine, resulting to profuse salivation. Cattle, sheep, and goats may cause or may suffer from excessive lacrimation, bloating, diarrhea, and polyuria. Reported in USA, Canada, Japan, France, and Netherlands. Next, we have the patchoulin toxicosis. Patchoulin is the mycotoxin, but it is causing more important disease in human than in veterinary or in animals. Produced by Penicillium, Aspergillus, and by Cyclamis. Patchoulin is detected in rotting fruit, apple juice, and moldy bread. Penicillium expansum blue mold causes soft rot of apples, pears, and other fruits. In cattle, there is tremor reported ataxia recumbency affecting function of rumen microorganism, resulting to acidosis, poor feed utilization, low loss of body weight, and diarrhea. In dogs, experimental studies tend to affect the lungs and the gastrointestinal tract, resulting to lethargy, diarrhea, pulmonary hemorrhage, and pulmonary edema. Young pigs, there were vomiting, salivation, anorexia, and weight loss reported. Next, we have the tremorgen intoxications. Tremorgens are heterogeneous group of mycotoxins known to produce neurological effects like muscular tremors, ataxia, incoordination, and convulsive seizures. Aspergillus clavatus cause neuronal degeneration and focal gliosis. Next, we have paspalum stuggers caused by Claviceps paspali that can grow on seed heads of paspalum grasses. The life cycle of Claviceps paspali resembles Claviceps purpurea. The mycotoxins are paspalinine and paspalitrums A, B, and C, and causes incoordination and ataxia in cattle, sheep, and horses. Penitram stuggers produced by Penicillium or caused by Penicillium crustosum, verrucolosum, and Aspergillus flavus and parasiticus that causes aflatoxicosis producing aflatoxin, can also produce this mycotoxin penitram, resulting to penitram stuggers. These are the penitrams A, B, and C, verruculogen, and roquefortine. Clinical signs in livestock are similar to ryegrass stuggers. Dogs, penitrams A and roquefortine are the most implicated mycotoxin causing penitram stuggers. Sources are the moldy cheese, bread, decaying organic matter. Clinical signs are weakness, muscle tremors, rigidity, seizures, and recumbency. Trichotillin toxicosis. This trichotillin mycotoxin constitute a large and diverse group of sesquiterpenoid compounds produced by Fusarium, Myrothecium, Cephalosporium, Stachybotrys, Trichoderma, and Trichothecium genera. Radiomimetic effects in tissues are produced, inhibit also the cellular protein synthesis. So the trichotillin that is known to produce feed or food refusal and emetic syndrome is the DON or the deoxynivalenol. While the hemorrhagic syndrome are produced by or are caused by T2 toxin and DAS, diacetoxyskirpinol. Stachybotrys toxicosis, which is caused by Stachybotrys atra, satratoxin, roridin, stomatitis, necrotic lesion in alimentary tract. Myrothecium toxicosis produced by Myrothecium verrucaria, producing roridin, verrucarin, pulmonary congestion. Food or feed refusal and emetic syndrome is produced by the ingestion of vomitoxin or known as the deoxynivalenol or the DON in pigs produced by Fusarium graminearum. The T2 toxin and diacetoxyskirpinol or the DAS also contribute. grown in maize, barley grains, or in mixed feeds containing cereals. Mycotoxicosis is caused by the Fusarium sporotrichoides and POA. Consumption of moldy wheat is the source of infection. Clinical signs are mucosal lesion, toxic effects on bone marrow, thrombocytopenia, and hemorrhages. Poultry, big lesions, abnormal feather formation, drop in production of egg, tissue hemorrhages, and increased susceptibility to infectious disease. Cats, there is vomiting, dysentery, ataxia, and dehydration. In cattle, severe irritation of the upper digestive tract resulting in hemorrhaging ruminitis. DAS toxicosis or diacetoxyskirpinol toxicosis. Fusarium tricinctum and a number of other Fusarium species are involved to produce DAS, mycotoxin, one of the most potent trichoticin toxin. It is an epithelial necrotizing agent with MOA or mechanism of action, cellular depletion, necrosis of lymphoid organs, hemorrhages in the skin and oral cavity, intestine, and major organs. In cattle, mucosal hemorrhages, depression, and salivation are reported. Pigs, hemorrhagic intestinal lesions and emesis. In dog, depression of the bone marrow activity, and this is associated with hematological changes. Hemorrhagic syndrome, T2 and DAS, diacetoxyskirpinol, they are potent epithelial necrotizing agent as mentioned. And these are produced by Fusarium sporotrichoides, causing sporadic outbreak in cattle, characterized by bloody diarrhea, necrotic lesions in the skin and oral cavity. Stachybotryotoxicosis, which is known to caused by this mycotoxin, satratoxin, roridin, and verocarin, produced by the toxigenic fungi Stachybotrys sartarum. They are cytotoxic and have a radiomimetic effect on tissue, resulting to necrotic stomatitis, widespread petechial hemorrhages, and blood-stained diarrhea that frequently results from hemorrhage and septicemia. Mycotoxicoses, roridins, produced by Mycotoxicum roridum and verocaria. They may grow on ryegrass and white clover plants in pasture or stored feed. Sudden death in sheep and cattle were reported, and weight loss and unthriftiness are seen. Diagnosis and treatment by clinical sign, also to demonstrate the toxin in the feeds. Apart from prevention or withdrawal of the contaminated feed, there is no known specific treatment yet for these conditions. Control and prevention, hygiene, analytical system, quality programs organized in feed mills, and regular checking by nutritionists for the quality of the feed ingredients used, including the possible level of mycotoxin present in the feedstuffs. Other tools may be helpful in the control of mycotoxicosis, like the use of toxin binders, acidifiers, different combination of acids for use in feedstuffs, or complete feed. These activators of the different mycotoxins present in feed and or feedstuffs. And that ends our discussion on mycotoxins and mycotoxicosis. Thank you and have a good day.